Welcome back to the Dr. Washbrains Podcast, where we break down complex health topics into easy to understand science based discussions. Today, we're challenging a common belief that walking is a simple and risk free exercise for everyone. For those with joint issues like osteoporosis, arthritis, or anybody who has osteophytes, walking may actually be more harmful than helpful. We'll discuss how these conditions impact your body, that why excessive walking can be detrimental, and what you can do to minimize the risks. So let's dive into the science of how walking affects your joints and what can be done to protect them. Walking is often considered a basic human function, which it actually is, but it actually involves a highly coordinated effort between multiple muscles and joints. Now, when you walk, the quadriceps in the front of your thighs and the hamstrings in the back, they work together to move your legs forward and extend the knee. The gastrocnemius and the soleus muscles, collectively which are known as the calf muscles, help to propel your body forward by pushing off the ground. At the same time, your gluteal muscles or your glutes in the hips, they stabilize your pelvis and provide power during the movement. Now, walking also recruits a range of secondary muscles to ensure smooth and coordinated movement. The hip flexors, particularly the iliopsoas, they help raise the leg during each step. The lower back muscles work to stabilize your core, while the muscles of the feet and the ankles, they contribute to balance and posture control. In essence, walking is not just about leg movement. It is a full body activity requiring synchronized muscle activity from head to toe. Now, this interplay of muscles is designed to keep your body moving efficiently. However, when joint conditions such as osteoporosis, arthritis, or osteophytes, they come into the equation, the mechanics of walking can change, leading to problems. Now, walking is often praised as a low impact exercise. But like any activity, too much of it can strain your body, particularly your joints. Excessive walking, especially on hard surfaces or for extended durations, can exacerbate pre existing joint problems and lead to new issues over time. So, joints, which are particularly in the knee, the hips, the spine, they are designed to withstand only a certain amount of stress and pressure. However, with excessive walking, these weight bearing joints are subjected to repetitive strain. Over time, this can lead to the wear and tear of cartilage, the protective tissue that cushions the bones. When this cartilage breaks down, the bones they begin to rub against each other, causing pain, inflammation, and stiffness, which can develop into osteoarthritis. Now, walking for extended periods, especially on hard or uneven surfaces, can cause microscopic damage to the synovial membranes. The synovial membranes, they surround your joint. Now, these membranes produce synovial fluid, which helps lubricate the joints for smooth movement. Excessive use can cause inflammation in these membranes, leading to conditions like synovitis, which results in swelling, pain, and restricted movement in the affected joints. In individuals with arthritis, this inflammation can be particularly debilitating. Now, excessive walking can also create muscular imbalances. For example, overworked muscles like the quadriceps or hamstrings can pull the joints, particularly the knees, out of alignment. Now, when muscles are not functioning in harmony with each other, they are not in sync with each other, they place a lot of uneven pressure on the joints. This leads to joint instability and further increases the risk of injuries such as ligament tears or joint dislocations. Over time, this instability can make the joints more vulnerable to chronic conditions like arthritis, or in cases where people have more high impact exercises, patellofemoral pain syndrome can occur. Weight bearing joints, such as the knees, the hips, the ankles, they bear most of the force when walking. Now, when you engage in excessive walking, especially if you're carrying extra weight or walking on uneven or hard terrain, these joints experience continuous stress. This can lead to the overloading of cartilage, increasing the likelihood of cartilage breakdown, joint degeneration, and pain. Now, for individuals with osteoporosis, excessive walking can be particularly harmful as their bones are more fragile, making them prone to stress fractures in the feet, legs, or hips. Now, if you already suffer from conditions like arthritis, osteoporosis, or osteophytes, Excessive walking, when you have all three, any three of them, it can exacerbate the symptoms. Arthritis can worsen as the constant motion grinds away at the damaged cartilage. The osteophytes, they can irritate surrounding tissue, creating more inflammation and discomfort. Osteoporosis increases the risk of fractures in weight bearing joints, which can occur from the repetitive stress of walking. Excessive walking, especially without proper footwear, can also lead to conditions like plantar fasciitis and Achilles tendonitis, which cause significant foot and ankle pain. Now, the more your foot absorbs the impact from walking, the more strain it places on the joints and tendons, leading to chronic issues that affect the entire kinetic chain of movement, eventually impacting the knees, hips, and even your back. Now, while moderate walking can be beneficial for maintaining joint mobility and overall health, excessive walking can do more harm than good. It can accelerate cartilage wear, increase inflammation, overload weight bearing joints, and aggravate existing joint conditions. To protect your joints, it is crucial to balance walking with rest, incorporate strength training, and use supportive footwear to mitigate these risks. Now, as we age, certain aging diseases develop in our body, which particularly impact the bones of the human body. But then we all think that walking is the root of all cures of the human body, but it actually can aggravate a lot of diseases and the impact that they have on the human body. Osteoporosis is characterized by weakened bones due to the loss of bone density, which increases the likelihood of fractures. This condition primarily affects older adults, especially postmenopausal women, but it can occur in younger individuals as well. Now, when the bones lose density, they become fragile, especially in areas that bear the most weight, like the hips, the spine, and the pelvis. Walking, especially on hard surfaces or for extended periods, can put excessive pressure on these already fragile bones. A seemingly harmless activity like walking on uneven ground can lead to stress fractures, particularly in the feet and legs. Fractures generally happen when your bone crashes into something which has a higher density in comparison to the bone. Now, the thing to make note of over here is that the footwear that you wear, it has to be soft enough that it bears your body weight, bears the impact that your body sends into the ground. And also when you're pushing into the ground, of course, like the ground will push you back. So we've got Newton working over here very beautifully. We need to make sure that the soles of our shoes, they are well maintained in a manner that we keep on changing our shoes from time to time so that the impact of the ground that we have to bear with each and every single step, it does not impact our bones in any negative manner. Because if it does, then there are a lot of chances of developing stress fractures in the legs. Moving on, how excessive walking harms the body. See, like I just mentioned, every step you take, it sends a small amount of force through your bones. Now, when bones are brittle due to osteoporosis, this cumulative force, it can lead to microfractures in the feet, hips, or vertebrae. Now, over time, these fractures can worsen up, causing chronic pain, spinal deformities, and mobility issues. Arthritis, particularly osteoarthritis, involves the gradual breakdown of cartilage in the joints. Cartilage serves as a cushion between the bones in a joint. आपके if this is a particular joint, then over here in between the joint, you will have uh, cartilage. This will be this will be your cartilage right in between the bones, right in between the joints of a bone. Now, yes, the cartilage serves as a cushion and it ensures that there is smooth movement and adequate shock absorption, like I just mentioned a minute ago. Now, as this cartilage erodes, the bones they begin to grind against each other. Now, when the bones will move, all right. Now, as the bones move, the cartilage it comes under pressure. All of a sudden, you might notice not over here, but yeah, the height of the cartilage it collapses, it shrinks, so the height of the overall joint shrinks. Many of you might have heard of how the spine, how the knees in elderly patients, it it swallows itself, like like the whole joint collapses on itself. The knees and the spine are very common examples. We also see that in our TMJ. and other joints as well. For those with arthritis in the knees, hips, or lower spine, walking becomes increasingly uncomfortable, forcing them to adopt compensatory walking patterns that alter the normal mechanics of movement. For example, you have been walking in a particular style, in a particular gait for years, and all of a sudden you develop arthritis. You'll start limping without even knowing that you do. Now, this will start putting up more pressure and will end up damaging the other leg, the contralateral leg, the contralateral joint, even. And this damage will not just be limited to that one particular contralateral organ or joint or the bone, but even to all other supporting muscles and systems. For example, if somebody develops a limp in their right leg, the whole core on the right side that will weaken up because they are not putting in adequate pressure. They're not using their right side well, and the left side, it will not. Apart from building like extra strength to carry on the right side, the muscles and everything will also end up deteriorating faster. I was reading this study back in 2019. I was I was creating another parallel study alongside it. For every single patient who goes through an ACL reconstruction, the anterior cruciate ligament, which is in your knee. For example, if you go through an ACL reconstruction in your left knee, there are 300% chances of the ACL tearing in your contralateral knee in your right knee because of how we allow the body to literally shift its weight on the other leg. Please, please ask your parents, ask your friends, family members, or anybody to stop doing that. It is your leg, it is not a walking cane. It is not a walking stick that आप उसके ऊपर extra pressure डाल रहे हैं. And वो walking stick भी ले लिया अगर तो उससे shoulder पे extra pressure आने लग जाएगा. Because वो भी balance करके चलना पड़ता है आपको. While moderate movement is often recommended for those with arthritis to keep the joints flexible, excessive walking can have the opposite effect. The continuous friction between the bones, combined with the added strain of compensating for sore joints, speeds up the degeneration of cartilage. This leads to greater inflammation, stiffness, and pain over time. Osteophytes or bone spurs are bony growths that form along the edges of the bone, often in response to joint damage or inflammation from arthritis. They typically develop in areas like the knees, the hips, or spine where the joints are under the most pressure. Now, bone spurs can create physical obstructions within the joints, reducing their range of motion and making it difficult to walk normally. The presence of these osteophytes can also irritate surrounding tissues, leading to inflammation and pain. Now, when these bone spurs they form in weight-bearing joints like the knees, hips, or lower spine, every step can be painful, particularly when the spurs they press on nearby nerves. Now, as these osteophytes rub against soft tissues or nerves, they cause swelling and pain. Walking, especially without proper footwear, can aggravate these symptoms, leading to increased inflammation. In severe cases, the pain can become so debilitating that it affects mobility and quality of life. So let's try to understand osteophytes a little better. Imagine this is your femur. All right. I don't want to cancel out the mic. So imagine this is your femur. This is your tibia. A very small bony projection, like in the form of my, which is being represented by my thumb rather, would grow. It will automatically grow. All right. It won't have any connection to pain or whatever, but it can partly even be genetic at times as well. It will grow. Now, as there is cartilage in between these two bones, all right, as there is cartilage in between both of them. The normal should have been like this, but it is not. Now it is like this. Now, when the joints they move, the the spur, it will end up causing harm in all of this area. You can get it diagnosed by getting an X-ray done. If you think that you have pain that is not going away in your joints, especially in your joints in the legs, get an X-ray done as soon as possible. Get it diagnosed. Having an osteophyte while you're walking is possibly the last thing that you would need. Imagine that there is एक कांटा है जो आपकी एड़ी में हमेशा के लिए रखा गया है and वो हट नहीं सकता. Not trying to scare you, but at the very same time, just trying to tell you to ask your friends, your family members, your parents, anybody who is of that age to get them to get it diagnosed ASAP. Moving on. For someone who's suffering from osteoporosis, arthritis, and osteophytes, walking can become a painful and risky activity. These conditions, they don't just affect the joints and bones in isolation. They work together to compromise the entire musculoskeletal system. As arthritis causes inflammation and osteophytes create obstructions, movement becomes increasingly difficult. Osteoporosis adds another layer of risk by making the bones prone to fractures. Together, these issues can severely limit one's mobility and independence. Now, in response to pain or stiffness, individuals with these conditions often alter their gait to reduce discomfort. This compensatory walking can place excessive stress on other parts of the body, such as the hips, the lower back, or the unaffected leg. Over time, these altered movements can lead to additional joint problems or muscular imbalances. So, for example, if this is your femur, all right, this is your thigh bone over here. You've got your quadriceps right over here and your hamstrings over here. Over here are your glutes. In this particular three muscle system, if there is an imbalance, suppose that if your quadriceps is not as strong as your glutes and your hamstrings, the glutes do not play that major of a role in walking. So we'll consider the hamstrings. So if your quadriceps are not as strong as how they should be in comparison to the hamstrings will start pulling your knee a little more. How do I put it? It'll pull the knee a little more strongly when you're walking. And the vice versa is also possible. This can cause the knee to jerk. And after that, if you fall, it can cause ligament damages, it can cause ligament tears. So that is why you need to make sure that all the muscles in your body, like in a particular system at least, are proportional to each other. Now, osteoporosis makes bones brittle, and arthritis reduces flexibility and balance, increasing the risk of falls. Even a minor trip or misstep can lead to serious fractures, particularly in the hips or the spine. Now, imagine this trip or this misstep happening because your muscles are imbalanced. Now, walking without actually taking into account these conditions, they can exacerbate inflammation and pain, turning what should be a beneficial exercise into a harmful activity. Given these challenges, it is essential to be mindful of how much and how often you walk if you suffer from any of these conditions. Now, wearing the right footwear can make a significant difference in protecting your joints and reducing pain during walking. Here are some key features to look out for whenever you're buying a new shoe. The first being adequate cushioning. Shoes with proper cushioning absorb the shock that occurs with each single step, reducing the impact on your joints and bones. This is especially important for individuals with osteoporosis as their bones are more fragile. The next is to have a proper arch support. A good pair of shoes will have sufficient arch support to help evenly distribute your body weight across your feet. Now, for those with arthritis, shoes that lack support can force the feet to roll inward or outward, placing added strain on the knees and the hips to stabilize it. Custom orthotics or shoes designed with supportive insoles can help maintain proper alignment. Now, make sure that the shoe that you have has a wide toe box. वो आगे से चौड़ा है. Because a shoe with a wide toe box, it'll give your toes the room to move naturally, preventing the formation of bunions or aggravating joint pain. This is particularly beneficial for those with osteophytes or arthritis in the knee, as cramped toes can worsen pain and lead to joint deformities. Those formal shoes that you wear, please make sure that they are not pointy at the top. Otherwise, oh my goodness, the pain that you will have to bear later on in your life is not funny. Whew. I cannot stress enough on this topic, why and how you should wear proper footwear. This this whole topic, this should be taught in schools. This should be taught in schools to children that you should buy proper footwear, because I know that budget can be a thing, but you can also get cheap and good footwear. It's not that you always have to go to the Nikes and the Adidas. Indian companies make great stuff. And also, Converse is back in India. They make the most beautiful shoes out there. Oh my goodness. Moving back to the topic, we're going to talk about stability features. Point number 4. For individuals with altered gait patterns due to arthritis or bone spurs, that for those people whose walking has already been changed because of arthritis or osteophytes, stability shoes can help control excessive foot motion, reducing stress on the joints. Shoes with built in stability or motion control features prevent overpronation or underpronation, both of which can lead to further joint damage. Point number 5, lightweight construction. A lighter shoe reduces the overall load on your joints, helping prevent fatigue during long walks. Heavy shoes, they require more energy to lift and move, increasing the strain on the lower body, especially for those with arthritis or osteoporosis. Point number 6, having a flexible sole. It'll allow your foot to bend naturally, accommodating the foot's natural movements during walking. Stiff shoes can force your foot into unnatural positions, which can exacerbate arthritis and osteophytes by restricting joint movements. Point number 7, low heel or no heel. High heels, they tilt your body forward, putting additional stress on the knees, lower back, and the spine. A low heel shoe or a flat footwear is preferable for maintaining proper posture and reducing joint strain. The shoes should be adjustable. They should be adjustable with Velcro straps or laces, and they are ideal, especially for those who have arthritis or inflammation. Now, these features allow you to modify the fit throughout the day, ensuring comfort and reducing pressure on these sensitive areas. Now, walking can be a very fantastic form of exercise. But for individuals dealing with osteoporosis, arthritis, or osteophytes, it is not without its risks. Understanding how these conditions impact your joints and muscles can help you make more informed decisions about your physical activity. Pairing the right type of footwear with a mindful approach to walking can help reduce the negative impact on your joints and protect your mobility in the long run. Thanks for tuning in to the Dr. Washbrains Podcast, where we strive to make health a dinner table conversation. Remember, your feet carry you through life. Let's keep them and the joints they support as healthy as possible. If you have any questions, you can send us an email. And if you liked today's episode, please consider subscribing to the channel. Leave a comment if you want to, and I'll see you in the next episode.